shelter at home or a safer at home order, in which that basically closed down our state's economy with the exception of essential workers. Now, obviously, essential workers was very expensive. And so we've heard mostly from barbers and beauticians in the last few days, especially since he's rolled out his plan that restaurants could open. But it was a very drastic move. It was a move that the entire United States took in the effort to slow the spread of the COVID-19 virus. So, just speaking as far as an economics in to the state of Tennessee. Yesterday, I serve on the Fiscal Review Committee, which this committee reviews all contracts as well as monitors the monthly revenue that comes into the state of Tennessee. And what we're currently projecting is that by the end of this fiscal year, which will end on June 30th, the state will be short $516 million over what it had originally budgeted. So we will, our speakers, both Cameron Sexton, Speaker of the House, as well as Lieutenant Governor and Speaker of the Senate, Randy McNally, has called the legislature back to Nashville starting on May 26th. We will begin floor sessions on June the 1st. And the purpose of this meeting will be for us to review the budget. We passed an emergency budget prior to leaving in the middle of March when we recessed to come home to basically shelter in place ourselves. But now that the nation as well as our state is beginning to open back up, we're coming back to Nashville, and primary purpose will to look at our budget again. It's not going to be good simply because we're going to have to try to find a way to cut additional funds out of the 2021 budget. We're hoping that the 1920 budget that we're in, that we'll have enough revenues to complete this year without actually having to do any cuts to this final, the 1920 budget. As all of you have heard, Tennessee has been hit with high unemployment. This is due to a lot of businesses closing and laying off to honor the request of the president as well as the governor. The Upper Cumberland area, which Cumberland County is a part of, and most of my Senate district that I represent, is currently seeing 11% unemployment. And those of you that have kept up with that know that we had been in the single digits, around 3% prior to the COVID outbreak. And Tennessee is currently experiencing somewhere in the range between 15 to 20% in overall unemployment. We processed, the Department of Labor and Workforce Development processed approximately 10,000 claims on a monthly basis with a staff of 20 people. Once the safer at home order went into place, businesses started closing down. We went from 10,000 a month to the first week, 40,000 additional claims, and then it continued to rise from there. And as of the end of last week, we were at 420,000 Tennesseans filing for unemployment. And that included those that are considered self-employed. This is the first time in history that we have allowed self-employed people to file for unemployment. Now, those people are experiencing a lag in being able to get benefits simply because that was a new program that was really offered by the federal government. And so the first priority was to process any claims of those individuals that were employed at a manufacturer or an employer that actually submitted the notice of layoff, so that the system could process those claims quicker, I guess you could say, if there is such a word. We went from 20 employees on a regular basis there at the Department of Labor processing those claims to now 300 employees. Obviously, that's been a huge challenge to the Department of Labor trying to train 280 additional employees to process these claims. Also, the maximum amount of state benefit that someone can get is $275, but the federal government passed the $600 supplement that goes along with that, that's extended until July 31st. There's been our computer system had to go through an extensive upgrade to be able to match up with the federal system. So there was a delay and a lag of those $600 payments going to individuals, but that upgrade was completed, and so they have been trying to get the additional $600 into the hands of those that qualified for the unemployment benefits. Obviously, you can receive the 275 plus you can get an additional $600, which can bring someone's total weekly compensation to $875. Now, I will say that I've already heard from business owners that are concerned with the fact that now they're trying to prepare to open their businesses, but they've got employees that are drawing $875 a week, and of course those individuals are not necessarily wanting to come back to work. And so spoke with the Department of Labor this morning, trying to find out exactly what our process is going to be able to get those workers back into the workforce. Of course, that money was to, whenever the federal government passed the $600, it was to make sure that that those individuals had enough finances to be able to continue to pay their rent, their light bill, their mortgage, their car payments. So that money was actually to be used to continue the economy, so that not all sectors would ultimately crash. So the governor announced last week that we would begin reopening restaurants at 50% capacity as of yesterday. That took place, and then retail stores will be able to begin opening Wednesday, tomorrow, at 50% capacity. They're supposed to follow specific guidelines as patrons come into the restaurants and into the stores. They can check your temperature. Obviously, there's supposed to be spacing tables to where there's not you're not bunched up together, and also no more than 6 people at one particular table. So we want to continue to practice social distancing. Elective medical procedures will begin. We've been told by the end of this week, Friday, the governor's office and his task force that he put together to come up with the guidelines. They've been slow getting them out, folks. I've been frustrated as a legislator. My colleagues have been frustrated as well, because we have not seen clear guidance over the last couple of weeks in regards to being able to tell our constituents, and especially those business owners, what they can do, what they can expect to do. So it's been frustrating for us as well. And so we hear you, and we feel your pain. So we've been on to the administration on a daily basis, trying to make sure that we know what those guidelines are going to be. We've heard a lot from barbers, beauticians, health spas. That is definitely some guidelines that we are trying to get to individuals, so that they know what they can expect when they can open. And that's certainly been a challenge. And again, I spoke with the administration this morning asking, do you have any type of guidelines? And the answer is, we're working on them. So I've gotten that answer every day this week. The state has ramped up testing. Obviously, any Monday through Friday, you are able to go to your local health department to get a COVID-19 test. We've also been doing pop-up tents around the state in various areas. They've been working on Saturdays and Sundays, doing more aggressive testing of Tennesseans. And then hopefully by the end of this week, we'll have the test that will be the antibody test, so that maybe you had the COVID-19 virus, didn't realize that you had it. So the antibody test is supposed to be out sometime towards the end of this week or next week. They're just waiting on some final FDA approvals so that we can get those out into the marketplace. Also, Tennessee has been very aggressive in doing their trace back as far as when someone tests positive, especially if it's someone that works in the healthcare field. Many of you know that south of you in Bledsoe County, the prison has experienced a high number of COVID positives. And of course, they have been able to work and trace back as to which employees actually brought the virus into the prison. So that is something that they have really been aggressive in trying to work backwards and see if who that family is, and make other precautions in regards to that. Just back one other statement, then I'll open it up for questions. Or a couple of more, just a couple of thoughts. 1 in 6 Tennesseans are currently facing unemployment. And obviously, we want to get our economy open back up and going as soon as possible. But at the same time, we want to be responsible in doing that. And I know that the governor is and the administration is working as hard as they can to try and bring out a responsible plan. I've mentioned to many constituents that have called, especially those that are concerned that we're reopening too soon. I understand. My comment is that if you don't feel safe, stay at home. By all means, stay at home and keep yourself safe, especially if you have a medical condition that could be.
The volume's so low.
Medical condition that could, if you were to contract the COVID-19 virus, that it would could bring long-term healthcare concerns.
I can barely hear him, sir.
So
he's muted.
Am I back? Okay. So as I was mentioning, I'm in the trucking business, so we do a lot of business in the Cumberland County area. We have been very fortunate in the fact that none of our employees, and many have tested. None have tested positive. None of our employees' families have tested positive, and so we have over 100 employees. So we've been very blessed in our company that no one has gotten the COVID-19. And on a personal note, many of you have heard about the Signature Nursing Home in the Allgood area outside of Cookeville. My grandmother, my last living grandparent, is actually a resident of the Signature healthcare facility, and she has been negative. So that's good news. So with that, I'll open it up for any questions.
All right. Well, thank you, Senator. That's really wonderful information. One of our participants today asked a question that I think a lot of us have wondered about, and that is, should those of us that have no symptoms get a test?
I think it's a personal decision. If you want to do that, that's one of the reasons that we are doing the additional testing sites throughout the state and throughout regions. Again, you can go to your health department if you want to test. I would certainly recommend that you do that, but it's not necessary.
Yeah, because I mean, if we tested negative today for the coronavirus, for COVID-19, it doesn't necessarily mean that tomorrow we couldn't be exposed to it and come down with it, correct?
Correct, exactly. The antibody test that I referenced a few minutes ago in my talking points can test to see if you've actually had the virus, and the normal test that they're giving is just to see if you currently have the virus, but the antibody test will actually determine whether or not you had the virus.
And even with the antibody test, from what I've seen, that doesn't mean that you can't get the virus again, from what the CDC is saying. So yes, it's good to know, but we can't take that as I understand it, we can't take that as carte blanche to be able to just be around people and think that we can't ever get it again. Is that your understanding?
Yes, ma'am, it is.
Yeah, challenging times for everybody.
It is.
Anybody else, if you have any questions, you can either unmute yourself and announce yourself or type the message into the chat box for the senator. While they're doing that, I do have a question for you, and you probably don't have an answer for me, so that's okay if you don't. I currently own a clinical massage practice, and I have 5 therapists that are independent contractors. And my question is, because I work primarily on my clients, and I have over 3,000 clients, are primarily from Fairfield Glade area. So we're looking at a higher risk group age-wise. I'm not comfortable in reopening the middle of May if the governor gives us permission to do so. So my question is, can my independent contractor therapists continue to collect unemployment as long as I continue to keep the practice closed? For the safety of my clients. So that's my overriding question right now, professionally.
Sure, and I think the answer is yes, they can. If you've not opened up, even though that the administration may give guidelines allowing you to open up what you need to do, but yet you feel like that you could put your clientele and or your workers at risk, then you're not open. Your business hasn't opened, so they should be able to continue to draw their unemployment. Now, that comes with a disclaimer. As I mentioned earlier, when I was speaking with the Department of Labor prior to this phone call in regards to the $600 and other employers trying to call employees back, that is a federal program. So there are guidelines that the federal government is going to give to the state in regards to that. All of this CARES Act, all of the things, the PPP program for small businesses, the EIDL, all of these SBA loans and grants that they're offering to businesses, to state governments, they have put all of these programs in place in such a hurried fashion that not all guidelines have been given, or not all rules, I guess you would say, have been given to the state. They've just basically said, here's the money, make sure that those that are unemployed get the money, but guidelines to follow, or rules to follow on that. But I'm going to say yes, that they should be able to, as long as you don't reopen your business.
Yeah, because I would think that,
Senator,
go ahead, Paul.
Senator Bailey, I have kind of a whimsical question. I'm a tech junkie. I'm interested in what those electronic devices are in your ear.
Those are they're Apple AirPods, and so they're my Bluetooth device connected to my iPad that I'm connected with you guys on. So it's you're in stereo.
Okay, good for you.
And for those of us, and I just found this out with my husband today, who have hearing aids, and with Bluetooth capability, you can Bluetooth your computer or your television soundbar, or Phil's now connected to everybody. He never has to listen to me again. It's awesome for him. All right, anybody else have any questions for the senator? I know we must.
Yeah. I can't believe I was really expecting a lot of questions.
I am too. I don't know my Rotarians to be shy generally, Senator Bailey, but anyone?
Can I ask a question, Deb?
Yes, Christy, please.
Okay.
Christy's
Paul.
Christy's excluded. She can't ask
Oh,
a
Christy, you
question.
can't.
Oh,
Sorry.
listen, I knew that was probably coming. Do you have any information on tourism, Paul? I know that's not, your area, but I was just curious about the Playhouse and of course our state parks, restaurants. That's a huge impact with our hotel, motel tax, etc.
Right. Well, no, I don't. The short
That's-
answer is
no,
I
that's-
don't have. I know that they are really wanting you to, when I say they're really wanting to get these venues opened as soon as they can, basically with social distancing in mind.
Mhm.
And if you're, it's just tough. I mean, I can say this: the governor's in a no-win situation whenever he
Right.
rolls out. There's a lot of people that thought that he was way too soon. There's others that think that it's not soon enough. A lot of people didn't think that we should have shut the economy down the way that we did. And I know that the Playhouse is really suffering. Believe me, and a lot of others are suffering as well. But in regards to the budget, there's going to be a lot of programs cut simply because of the cutting $500 million out of the budget. So,
Right.
It's going to be really tough when we go back. Actually, the last time that we were in such a budget crunch was in 2008, 2009. And that was during what they consider the Great Recession. Now, those that were in the legislature during that time on our conference calls we've been having said that those years don't compare to this year's as far as the severity of the amount of tax revenue that we've lost.
Okay. Well, I was very confident when I seen Commissioner Ezell was on there, so I know he's going to look out for hospitality services, tourism, and everything like that. But we, of course, all want to be safe. So
right.
I appreciate you guys.
And the state parks have opened up. They're
Right.
allowing,
Yes.
Yeah.
So that's
the state
exciting.
Parks, yeah.
All right. Thanks, Christy. I'm going to
You're
remute you
welcome.
here. All right. Another question for you. And I think you may have addressed this. Did the federal $600 have a 2-month date on it? You had said June or something?
It ends July. It's through July 31st.
Okay.
All right. Thank you for that. And then let's see.
Another question on reopening.
Go ahead, Paul.
You, in your segment about reopening, nothing was mentioned about one of the larger venues for group and mass meetings that are churches. What's the current thought about guidelines for reopening of churches?
Well, my understanding is that the governor is supposed to be bringing guidelines down this week in regards to churches and gyms and so forth. There's been a lot of churches. My church, we've been doing drive-in services, and so we for the past 2 weeks, starting with Easter weekend and then the weekend following. This Sunday, we may have jumped ahead just a little bit, but we only had about 1/3 of our congregation. I just attend a small country church, but there were about 33 people came, and we actually went inside because it was raining, but the families all sit in one area, and we social distance out throughout the crowd. And of course, we'd asked the question, if any of you been sick, any of your family members been sick, and everyone reported that they hadn't. So we actually had church inside our building this past Sunday. So, hopefully the Gestapo doesn't come get me for that.
I have a question. This is Tony. Do you hear me?
Yes, sir.
Tony, go ahead.
I have a question regarding, well, we'll be applying as a state. You mentioned there's going to be a $500 million plus shortfall related to this. But my understanding is that certain costs the federal government will reimburse, such as the additional resource costs for the unemployment people going from a staff of 20 to 300?
Yes, there are some guidelines that, or there is some federal money that's coming down. There's federal money that's going to be going to hospitals. There's some federal money that's going to our school systems. But when it comes to the overall operation of our state budget, so think of it this way. The state's budget, just for easy numbers, is $40 million. So $40 billion, $40 billion. Half of that is federal money, and the other half is what we generate through sales tax and F&E tax and any other small taxes that we have. And so what the federal government is currently telling us is any of this money that's coming into the state, for example, there's a $3 billion that they're sending into the state. That is specific to be for COVID-19 responses. It could be for the testing. And again, they're saying that they're sending that $3 billion to us, but they haven't sent all the guidelines as to what that $3 billion can be used for. So again, we're being told that it's coming. We've been told what the amount is. We've also been told that it's for the COVID-19 pandemic, but we haven't been given specific guidelines as to how we can spend that money. Did that answer your question?
Yes, thank you very much.
Okay.
All right, thank you. Also, we have another question from one of the members. What is the degree of concern of a spike after opening the state? And if there is a spike, will the state shut down again? Oh, there we go. Sorry. You go ahead.
Okay. Okay. So I think what we're going to see in certain areas, there will be more positive tests. Number one, we're starting to open up. Number two, we're being aggressive about our testing. So the more testing that we do, the more cases of COVID positive that we're going to find. So we're going to see that. I think that and I can only speak in generalities because this would be the governor's decision, and there's not been any conversation that I've been a part of in shutting the state down if we see a huge spike. What I think that we would see is a certain area. For example, if Cumberland County had a huge spike in cases, then I think that they would work to shut down Cumberland County or work to limit those coming into Cumberland County as much as possible, or the region, or the entire Upper Cumberland region. Again, they're trying to do the trace back, and that's one of the most important things that the health department thinks is important, is tracing back to where it originated from. So I don't know that we would see a full shutdown of the state.
Okay, yeah, I know that that has been a concern. And of course, you know, because you live on I-40 as well, shutting down a county that's on I-40 is just about impossible to do. So that would be a real challenge. Alan, I see that you've unmuted yourself. Did you have anything that you wanted to share?
Well, I just wanted to say I really appreciate Senator Bailey and the way he works with his constituents. I called him over the weekend, left a message. He called me back yesterday and agreed to do this. And that's just an example of how he works with his constituents and is available, answers questions, and helps us in any way that he can. And I just really appreciate that. And thank you, Paul, for being on today and giving us this information. Sure,
absolutely. And I'm available anytime that you guys want to contact me. You can certainly call my office. You can email me. You can call my cell phone. I'm happy for you guys to have my cell phone number. If you have pen and paper, I'll be happy to share that with you. It's 931-260-3909. 931-260-3909. I just ask that during this time, that you be patient with me because I'm getting a lot of constituent phone calls in regards to unemployment. And so our office, as well as I, have been working to help all those constituents get their claim filed for their unemployment.
Yes, we
But
can
thank
only
you for that.
imagine. Yeah, we can only imagine what time frame that you guys have been in. I mean, the amount of work that you've been under in a 24-hour day. So Valerie had her hand up. Valerie, I've unmuted you. Go ahead if you have a question.
Well, first of all, I'd like to thank you for inviting the Crossville Breakfast Rotary Club to join this. It's
Oh,
been
you're
very
welcome.
informative, so thank you. My question is for Senator Bailey, of course, and I'm just curious, you talked about budget cuts, and as you know, Crossville and Cumberland County have some major road projects coming up, and I wondered if that was being considered as far as cutting those from the budget.
Well, just so everyone understands, and Valerie can, I'm going to ask you this question. Do you know how we fund our roads and bridges, especially down to the local level?
Yes.
And that's by what?
Fuel tax.
Fuel tax. And what have we seen? We've not seen Tennesseans. We've mostly seen America shut down, and I think we're at I think the last number that I saw, and this was probably through a transportation magazine that I get, that 33%, we're down 33% right now as far as the amount of truck traffic in the United States. And so the vehicle traffic, or the personal passenger vehicles, I think we're down about 25%. So that is going to ultimately have an effect on our roads and bridges. Now, you also know that we plan on a 3 to 5 and 10 year transportation cycle. But I cannot tell you with these drastic reductions. For example, I'll tell you this. We are anticipating fuel to be down $1.1 billion is what we're estimating. I'm sorry, that's the overall, my bad. We're estimating that we're going to be down $321 million just in our fuel tax collections alone. So that's a huge, and that's on an annual basis, but that's a huge hit to us.
Mm-hmm. You're right, it is.
The 516, and so I just want to clarify this to make sure everyone understands, the 516 million that I spoke about earlier, those are general funds, and that's also our fuel fund that we're going to have to work off of. Just remember the 321, because you're saying, well, how can that be? That's over half of the 516. The 321 is based on an annual number. The 516 is based on what our projected revenue loss is going to be since we shut down the state's economy.
Thank you.
I think it's going to be interesting to see as time goes on exactly how long it's going to take from recovering or how long it's going to take the state to recover economically from a 1 month shutdown of everything. I mean, I can't even imagine what that number might be, but I would think it might be in the years. Honestly, what do you think?
Well, economists are saying that we could be looking at, a long term. This could be a long term effect. They're saying that we're going to be 25% lower for the rest of the year, basically, than what we should have been. That's as a nation as a whole. And again, that's all based on information that we're seeing today. It could change. The good news is we're coming into spring, and so I think we're coming into a time that once people feel safe, once they feel like that they can get out and participate again in functions and begin to travel again, we may bounce back a little sooner than what economists are saying. But ultimately, they're saying 25% reduction in the nation's you know, growth. So instead of having any growth, it's going to be a 25% reduction.
Oh, okay. Anybody
Let me,
else?
let me,
Oh, sure, go ahead.
I just want to, and I may have told you this a while ago. If I'm being redundant, I apologize. But so, you know, in the trucking business, each week I track the number of miles that my fleet runs. Now, I'm just a small company. We have 60 over the road trucks, and we run coast to coast. And I track each, our average is 145,000 miles per week that our trucks run. That's the total miles that all units run, and we usually average around 145,000 miles. So I can back up and tell you that 3 weeks ago from this past Friday is when we started seeing a reduction in the number of the amount of freight in the market, because we were at 146 the week before. We went to 136 the next week. We dropped down to 126 this last week. So we have continued to see a slowdown, and I'm going to estimate that we'll probably be somewhere around 115 to 120,000 miles in this week, once we end this week. And that just basically goes to show you how that the freight industry is usually the first economic indicator. We see when things pick up, we see things slow down. And so we are definitely seeing a major slowdown all across the United States.
Do you attribute that to the fact that people are just not out buying? Is that the reason for that? Okay.
Well, so one thing, the auto industry has completely shut down. So all of the little tier 2 and 3 plants that make the components that go into the big plant to make the car, those have shut down. So that's one sector of our economy that's slowed down. This is the time of the year that there's a lot of fruits and vegetables brought out of Florida and out of California, and these are brought by refrigerated trucks. You're talking Brussels sprouts, you're talking asparagus, you're talking citrus that's coming out of Florida that comes up from southern Florida, and as the season progresses, it moves all the way up to the northern part of Florida and into Georgia. And there's just that produce is just basically rotting in the field, the same as the vegetables out in California. Yesterday, one of our employees had a birthday here in our office, and so we did a carry out at Longhorns. We could not get Brussels sprouts, and we could not get asparagus. They just did not have it available. Well, the problem is all of that's coming out of California, and number one, there's no trucks out there to get it, but number two, they currently don't have a market to be able to sell all that produce into. Wow. So we're going to see our farmers are going to be hit hard. I don't know if you guys have followed this, but the poultry industry and the pork industry, and now they're saying the beef industry. So I'm not someone to tell you to go hoard, but if you don't have but one pack of hamburger in your freezer, you might want to pick up an extra pack just over the next few days.
It sounds like we can't even be vegetarian because we're not going to get our fruit and vegetables either if we wanted to be. So. Well, thank you very much. Again, we have Senator Paul Bailey with us with the Fairfield. Sorry, I knew it would come to me. I almost said Rand, and I realized that's the wrong one. So Senator Paul Bailey with us with our Fairfield Glade Rotary Club today. I do have a quick question for you. I have recorded this meeting, and normally we share it on Facebook and on our webpage. Do you have any objection to us doing that, Senator?
No, I'm good.
Okay, very good. Yeah. Well, you are welcome to hang around with us while we all check in with each other, but I'm pretty sure you have some pretty important things that you need to get to. So thank you once again for taking your time to spend this time with us and to inform us. It was wonderful.
Absolutely. Thank you.
All right, thanks.
All right, bye-bye.
All right. Well, that was awesome. I'm going to go ahead and unmute everybody here for a second and just let's see. Okay. All right. So let's go ahead and just do a real quick check-in with everyone and see how we're all doing. And again, just a reminder that for those of you who have volunteered for the mask distribution, that's going to be on Thursday from 10 until noon. And I know that they will not have as many masks as what they had a week ago when we did the mask distribution at the community club conference center, but they still need our help in traffic direction. So thank you for those who volunteered for that. Okay, let's see. Let's go ahead and first of all, Valerie, we're gonna unmute our guests here today. Tell us a little bit about yourself and share with us how you ended up on the call today.
Okay. I ended up on the call, of course, being invited through email.
Oh, hold on. I'm gonna mute everybody and then unmute everybody individually. So there we go. Miss Valerie, there we go. Get rid of the background noise. Okay, honey, go ahead.
Thank you. Thank you. I work for the city of Crossville, for those of you that don't know me. And we have been working in shifts. So working from home for a few days or a few weeks, depending on which department you're in, and then in the office for the other time. So we've been rotating back and forth. Today's my last day at home, working from home. So I am ready to get back to work and get a regular schedule, but my family as well. And I'm thankful for that.
Oh, good. Glad you're staying healthy, honey. And you are with the Breakfast Club? The Rotary Breakfast Club?
Yes.
Oh, okay, good. Nice to have you with us. Thank you very much. All right, that's awesome. Okay, let's see. Who else do we have on here that is new to our meeting? I don't know who R. Hellmond is. Let's see if I can find out. Who's R. Hellmond? Speak, if you're willing.
Hey, Deb, I can take care of that. This is Tom Hansley. How are you?
Hey, Tom.
That is Ron Hellman. He's an employee here. He's a member of the Breakfast Rotary Club.
Great. Wonderful. Well, welcome, Ron, and thanks for joining us today. And Tom, how's things going at the hospital? Fill us in.
We're still holding steady, opening a few areas back up, opening some diagnostic services, and just trying to see how that goes. So far, so good.
Tom, has our hospital, has Cumberland Medical Center been at all involved in taking care of the huge number of positive cases from Bledsoe County Prison?
We have had some of those come through our facility. I wouldn't say an extreme number, but we have had some.
So, okay, so we've had more that you guys have had to deal with then. What about personal protective equipment at the hospital? How are we set for that right now?
You know, that's in short supply, Deb, as you go across the nation. We're not alone in that. All facilities are having trouble. They have to monitor it very closely. We do have a supply. If I told you that we had a massive supply, I would be not telling the truth. We do have a supply of equipment that we're trying to be careful with and trying to monitor how we use very closely. But that is a concern for all hospital facilities, all healthcare facilities.
All right, so if anybody has any extra masks, you guys could use them or any other equipment, correct?
Let me say this, Deb. I will say that the hospital wants to extend a huge thank you to the community for the number of masks that we've received. I think it's in excess of 2,000 masks, cloth masks that the community has sent into the facility. And we are requiring anyone that comes in our facility to have a mask. All of us, if we're outside of our individual offices with anyone, we have to wear those. So thank you so much for that. That's been a huge help for us. And it's allowed our staff to meet some needs that we have in place. So thank everyone for that.
Good. All right. Well, glad to know that you guys are all doing well, and I appreciate you popping on, Tom, to share. Tom is a member of our club, but thanks for your insight and information. I appreciate it. All right. I see that we have somebody named Jeff that I don't recognize. Hi, Jeff. I've unmuted you. Introduce yourself to us if you would.
Hey, my name's Jeff Fires. I'm a member of Crossville Breakfast Rotary, and certainly appreciate you inviting us all here today.
Well, thank you for joining us. It was, I think, a pretty informative meeting, and the more information that we can get out, the better. So great. And where do you work, Jeff? I'm trying to read your plaque on the side there.
Oh, over at Bean Smith Burnett law office here in town.
Oh, okay. Good to have you with us. Thank you. All right. So before we go ahead and end the meeting today, any comments or questions from any of the Rotarians that we'd like to?
Yeah, Deb, I have a comment. Paul Whittemore.
Oh, yes, Paul, please.
I just want to add for everybody on this conference call, a thank you. It was a good note that Deb put in our Rotary News about Howard Hickerson's update for everybody's information. Of course, he is an honorary Rotarian. He's been at Dominion Care Facility for about the past year. And just on yesterday, Grace Givers was transporting him under direction from his guardian sister, caregiver, and they are moving him to North Alabama to be close to that family, his sister. And additional care is required, and it's been a good move. But she sent back Berger, his sister, sent back a note to me thanking everybody in our community for the past support that has been given. And she highlighted particular thanks to Rotarians from our club, and I would identify them as Deb Birdsall, Mike Williams, Laura Warner, and Kelly Tipton in particular for their presence and concern in this particular area. But as of yesterday, Howard is in North Alabama, and so everybody should be aware. And an address for sending notes was in the Rotary News. So thank you.
Okay, thanks, Paul. Thanks for that update. Oh, yeah, we got a thumbs up signal from Villa. I see that we have Jan Westmark with us. Jan, why don't you go ahead and introduce yourself to the club?
Okay, hi, I'm Jan Westmark, and I just moved to Fairfield Glade about 3 weeks before everything shut down. But I came to one Rotary meeting.
You did.
And that was exciting, but then of course now I've been in my house. But I will say I'm excited to be here. I have walked every single golf course, front and back 9 of all of them multiple times over the past 6 weeks, so that's been amazing. It's beautiful here. I run a horse magazine out of my house. I'm the editor-in-chief. I have a staff that works all around the country, but we all work out of our house, and that's still going on. And I guess that's it.
Okay, good to have you here with us, Jan. Great to see you. Villa, you haven't spoken to us yet, honey. Villa is the president-elect for the Crossville Breakfast Club. Is that right? Do I have that right?
No, actually, that's Valerie, I believe.
Oh, that is Valerie. You are past president.
Yes.
Yes, there you go.
A few times ago, I'm an old one, but I am the practice administrator here at Plateau Pediatrics. We've not had a dull moment, let me tell you. Since March 12th, we've been going high gear with our extensive, extravagant PPE and having lots of fun.
Good. Are you seeing anything as far as the COVID's concerned with the younger population?
We've done lots of testing. We've not had any positives. If we're concerned, we're doing some parking lot visits and that kind of thing, but we've not had any issues.
Good.
Other than trying to keep up with ourselves and breathe and all those things inside all these respirators.
Oh, no kidding. I'm highly claustrophobic, and every time I put on a mask, I think I'm not sure I'm going to live through this. So I can appreciate that. Thank you for joining us today. All right. Oh, Alan, go ahead.
Hey, I got to say hello to Villa.
Hey, Alan, how are you?
You keeping Sherry straight?
Trying to. She avoids me on Tuesdays. She's out building a cabinet or a bench or a shelf or something.
Exactly.
We've had all kinds of fun.
Good. It's good to have you on. It's good to see you.
Well, I do appreciate you all inviting us. It's good to see people. We've only seen our workmates and our family for the last couple months, so it's good to see some new faces.
Right. And also, Jan, I need to talk with you. How do we connect? Where'd Jan go?
I'm right here. Okay, I had to unmute myself. I don't know.
You mentioned a horse magazine.
Yeah.
I need to talk with you.
Okay. You can call me or email me.
Where am I going to find your information? I can give you mine. Are you on Facebook?
I am.
Okay,
Jane
we'll connect on Facebook. Last name?
Westmark, Westmark. And my magazine is called Sidelines Magazine.
Okay.
Yes.
Alan Snow.
Okay.
Thank you. Thank you, Deb.
Sure, let's take care of a little business here too. That's great. Networking, that's awesome. All right, I am going to now unmute everyone so that we can go ahead and close our meeting with the four-way test. So everyone is now currently unmuted, and I will start the four-way test. The four-way test of the things we think, say, or do. First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendship?
Be beneficial to all concerned.
And fourth, will be beneficial to all concerned. Wanted to let you guys know that our district governor, Greg Masiolik, was on the call with us today too. He had to jump off to get ready for the district-wide meeting this afternoon. So at 2 o'clock this afternoon, you can watch that on Facebook. It's going to be some educators that are going to be speaking to us about the situation with the children not being in school in the state. So please feel free to do that. And I'd like to once again thank everybody for joining us today. Everybody have a wonderful day.
Bye.
Bye.